Hello dear fans. The nose as a respiratory organ. The human body carries out a lot of processes that are important for life. Breathing is one of these processes. Several organs take part in its implementation, including the nose. What organs are involved in breathing? The respiratory organs include several parts of the body. The airway begins from the nasal cavity and external nose, and then the process continues to be carried out by the pharynx, larynx, trachea, bronchi, and lungs. All of these organs, except for the lungs, are airways. It is along these paths that air enters the lungs. The pulmonary parenchyma, together with the lungs, form the respiratory part, which exchanges gases between air and blood. The structure of the external nose. The outer nose has the shape of a triangular pyramid. Paired nasal bones make up its bony part. Along the midline of the nose, these bones connect to form the bridge of the nose. The frontal processes of the upper jaw are located lateral to the nose. These processes become the lateral surfaces of the outer nose. At the bottom of the nose, the bones form pear-shaped holes. At the edges of the holes, cartilage formations can be observed. The upper rib of the quadrangular cartilage and paired, lateral, accessory and wing cartilages. The nasal process of the frontal bone forms the bridge of the nose. Each formation is covered with a layer of skin. It can be said that the nose consists of two nostrils, the wings of the nose, the septum of the nose, and the lower edge of the pear-shaped opening. Nasal cavity. The skin covers not only the outside of the nose, but also the inside of the nose. It is the inside of the nose that is called the nasal cavity. It is divided into two halves by a partition. At the bottom of the cavity are the horizontal processes of the upper jaw and palatine bone. In addition, these appendages are the basis of the hard palate. Respiratory area of the nose. The respiratory area of the nose is the mucous membrane. This membrane continues into the paranasal sinuses. The mucous membrane is covered with cavernous tissue and mucus glands. The mucus glands are usually located in the lower part of the turbinates. If the corpora cavernosa are filled with blood, then the thickness of the mucous membrane can reach up to 4 to 5 millimeters. The shell can swell quite strongly. Sometimes it even completely closes the nasal passage. The ciliated epithelium is located on the nasal mucosa. Among its cells are secretory cells that resemble goblets in their shape. Congenital anomalies of the respiratory system. Nasal malformations are rare. These include a complete or partial developmental disorder, excess growth of parts of the nose, and improper positioning of parts of the nose. In the world there were such defects of the nose as a split nose, a double nose, fistulas or nasal cysts, malformations of the turbinates and other disorders. Thanks for watching.